All right, welcome. We are going to talk about inflammation today. So that is like a root cause, a symptom, all kinds of things. This is our Take Your Health Back Now podcast for May 3rd, 2024, if you're catching the replay. Remember, we are doing these live in our Facebook group now. So if you want to join us, hop in over there. And if you are there, we will respond to any comments, questions that come in live.
Yay. Well, hopefully this is working.
Yes.
If anybody paid attention last week, we never did do our podcast because
Yes.
we just could not get it to work.
Yeah.
Because Facebook changed things up and didn't let us know. So we found out the hard way. Anyway.
Yes.
So inflammation. So the inflammation is the big root cause of everything. So we're going to dive kind of deep into that and, what inflammation is, what actually causes it and what it's causing. But it is, if you look at it really in a very broad picture, it is the thing that causes symptoms.
Yes, which is why on our trees back behind Kendra, it's not
right.
Like it's the trunk.
You can see we've got the root cause. These are the roots, but they cause inflammation, which causes symptoms. So we'll talk about that. But what prompted us to do this podcast in the first place was I had seen somebody on Facebook and she had asked the question, how can I eliminate inflammation in my body?
Right.
So that was her question. And she had 190, she ended up having more, but when I saw it, she had 190 responses. And so I'm like, let me see what these people are saying. It's because this is what we do. And so 190 answers, and they were all really well-meaning and pretty good answers. And most of them were natural solutions, but they were always to reduce inflammation and reduce the symptom you're experiencing from the inflammation.
Right.
But I didn't see one. I think I saw one that was talking.
Yeah, I feel like, and I think I looked after you, but yeah, like more, like bits and pieces were more looking at root cause, but there was no like full answer, probably because the full answer is this giant, lifestyle change. But yeah, it was like either a Band-Aid, which more natural Band-Aids, but still Band-Aids, or like one tiny little piece that would only address one tiny little root cause. So clearly that's not going to clear all of the root causes of inflammation.
Right. Like most people, well, I wrote down some of the answers just so we can because they were good natural natural ways to reduce inflammation, but in the moment. So, anytime that you do something like that, a Band-Aid fix, whether it's medication, a supplement, a natural product that is really good for you, if it's a Band-Aid fix, whatever's causing that, and in this case, it was inflammation, what's causing that inflammation is still growing and festering. Right. So you've done nothing except for alleviate the discomfort. And that didn't really help the inflammation, if that makes sense. I did see somebody say toxins, which was true. That is a root cause. But if you look, I don't know if you can even see the poster, the words, but over there, one of the roots is the toxin root. And there's many, many, many. It goes very deep. Oh, yeah. There you go.
Oh, it's backwards, but that's okay.
But yeah, so he was right. Toxins is a huge root, but that's just one of the many things. So anyway, and I had written down here to remind you, there is no magic bullet. There is no magic supplement.
We've talked about that.
Product, that's a big one. Diet, detox, anything to eliminate the inflammation. You have to go deep. So
and I feel like, and I'm not even sure if I saw the exact same person as you, but I just kind of searched for it. Maybe someone else asked the same question.
Right.
But there was a few diet recommendations that were good too, but they were like, when they say like, take out dairy, that someone in their mind, that's probably going to be a short-term thing. Like, oh, I'll take out dairy for like 21 days, and it's not all the things.
Very inflammatory.
Yeah.
It is, but there are so many other things coming into your life that are causing inflammation. So, of the 190 answers of treating the symptom, I just wrote down a few. So detox protocols, you see that all the time. That drives me crazy because you cannot do you shouldn't do a detox protocol unless you are ready. Your body is ready for that. And if you're not doing all the other work, detox protocol could be the worst thing for you.
Yeah.
Infrared saunas, yes, great. But that's going to make you feel a little better, but that's not going to fix what's causing this inflammation.
It's almost like detox protocols, like it increases your detox pathways, that helps with those things, but it's not, if your body's not ready for it.
Right.
Not
and
a
some
long-term
people aren't
solution.
even sweating. And if they're
Yeah.
going into the infrared sauna, that can just be really detrimental to your health to do that.
Yeah.
And be ready for it and not to be doing anything else on top of it. There was turmeric, ginger, green tea, things like that. And they're all really good and they are all anti-inflammatory. But again, that's just tiny
Right.
thing.
Like those would be good solutions if you've got your foundation of health, you've worked with us or someone else. You've got that foundation of health in place. You're doing all the lifestyle steps, you're really living it. And, you fell down and you have bruising. That's natural inflammation. Like it's supposed to be there. Those things would help like short-term acute issues like that. They are not really a long-term solution. They're just a support when that inflammation is doing what's supposed to do.
Right. Yeah, because doing something to alleviate that inflammation, the natural immune system's body response, which is inflammation, to get you to that endpoint faster, like Jenny said, or just alleviate the discomfort. That's all good, but chronic is totally different. We'll talk about that. Different. But they were talking about vitamin D3, which is clearly very good for you, but it's not going to cut it by itself. Zinc and magnesium, all of those are vitamins. Okay, well, if you're deficient in those, why are you deficient in those? You got to go much deeper. Fish oil, omega-3s, yes, because omega-6s are extremely inflammatory, but again, that's one thing, like the dairy, that is inflammatory. Anti-inflammatory diet, I saw somebody say, which yes, that's very important. That was a good one. I saw people say carnivore diet. I saw people say no meat diets. They were like diets.
Oh my gosh. This lady, like, I wonder what went through her mind. Like, we're looking at this, seeing like how overwhelming it is and how it is bits and pieces. Like,
she was like,
okay, never mind.
Yeah. Somebody put toxins, like I said, and then no meat, all veg, all meat, no veg. And then there's the cure-all products. There's some products, there's some people out there that drive me crazy because they just talk about their product being the cure-all for everything.
Right.
Everything. Like you don't have to change anything in your life, but just take this product for anything. Inflammation? Yes, we've got one. Weight loss? Yes, we've got one. Like you got, we've got one. But don't change anything in your life.
Right.
So it always just gets me. But those were just a few of the examples that she got. So we want to explain the real reason.
Right.
So first we wanted, and we kind of already touched on this, but we wanted to talk about inflammation. So there's acute inflammation and there's chronic inflammation. We've talked about this before. Acute is short-term, immediate. Like we've talked about that with poisoning and toxins before. And chronic is small doses, but long-term. Yeah. Acute inflammation is your immune system. I mean, that is your system's first reaction to.
And it's good.
And it's good and you need it. So something like you cut your finger. What happens? You cut your finger, pain, hurts, starts throbbing. You can feel that throbbing because the blood rushes to it. It might get red. Might
feel hot.
Yeah, hot. Those immediate responses. Yeah, I wrote down red, hot, swollen, pulsates, and painful. Those are the 5 things you can feel with inflammation. That's normal and that's good. That's your body immediately working to heal that, to start the process. Or if you get a fever, like when kids get a fever, you should let them have that fever.
Yeah.
It's so high that it's dangerous, but otherwise that's your body's first line of defense with the immune system to, get rid of that infection and help the body heal.
Yeah.
So with an example with that, if your child has a fever, you immediately give them Tylenol to make them feel better, brings the fever down, but what's causing it, that infection or whatever, is still there, causing it.
Right.
They can't feel it.
And now you've dampened the body's natural immune response with that medication. So they're actually going to be most likely sick longer, even though they won't feel as bad in the short term.
Exactly. So the only time that would be good is if, it gets so high that it's reaching a dangerous level.
Right.
Clearly, then bringing it down is, a good idea. Or at that point, ice baths, things like that, just to bring down the body temperature. But otherwise, that just is your immune system's natural response. So remember, that's the acute. That is normal. That is good. So I am sure what this particular person was talking about was chronic inflammation.
Right. She wouldn't say, how do I reduce inflammation? She would talk about whatever injury or infection she had going on. So that's how you know.
Yeah. So chronic inflammation is when your body is just chronically inflamed, and it's because your immune system is constantly trying to fight different things, all the time to keep itself. And that's when autoimmune issues come into play, because it starts reacting to everything and then starts attacking itself. But it's just this inflammation that is chronic and then eventually goes systemic. But the problem with the treatments or the Band-Aid fixes with that is that, and what we run into a lot of the time is immune suppressants. That's a really common drug right now that they're giving out. So for somebody like that, say, has Crohn's or ulcerative colitis
or
lupus or any of these autoimmune conditions, they're getting immune suppressants. But what it does is turn off your body's response.
Right. So this is why, like when you hear these pharmaceutical commercials, all of them, oh my gosh, the stuff they say is going to happen is crazy across the board. But all of them say, you may be more prone to infection. You may get sick more. You might be more likely to die from common, germs issues, those kind of things. And it's because they didn't develop these drugs specifically for this issue. They just know this drug turns off the entire immune system, which is a giant Band-Aid blanket, and will also cover up this one symptom you're having.
Right. Exactly. And some of them are targeted to specific parts of the immune system. So maybe not your whole immune system, but it's still turning off the part of your immune system that would be fighting that infection or whatever it is. And now it can't. And even that word that we cannot say, not the one that starts with a V, but the medication that starts with an IVER. You know what I'm talking about? I think we got booted off once before for saying it, so I'm not going to say it. But that controversial medication, it is also an immune suppressant. So we personally have never been fans of or proponents of that because of that reason. So it may help in the short term, but that's why it helps, because it is an immune suppressant. So just keep that in mind. So anything like NSAIDs or things like Tylenol, ibuprofen, things like that, steroids, biologic therapy, and then the immunosuppressants that we were talking about, all of those are a Band-Aid fix for an immune response to chronic inflammation. And then natural remedies would be some of the things those people had mentioned, or there's many, medicinal herbs and plants that are, relieve pain and anti-inflammatory. And I mean, there's so many different anti-inflammatories.
Right.
Again, it's still treating a symptom, and you want to go really deep and address the why. That's the only way to stop chronic inflammation and get, resolve your symptoms and then really be able to restore your health. That is the only way. So you got to think about the really deep why. So that's,
and there's not ever just one why. I know we keep saying this like on every episode,
right,
but there's not one why. And that is part of the reason why our program has so many areas that we touch on. We don't just focus on one area because nothing in your body is in a bubble. Your thyroid doesn't function all by itself. So just focusing on that one thing is not going to give you overall health at all.
Right. Yeah. And that's why it goes so deep, because so many things are coming in. We'll talk about this, that are causing metabolic dysfunction, and metabolic dysfunction in your body is so many things. And then all of that is causing the inflammation, which then causes all of these symptoms, which then is causing, it's like the cyclical effect that just keeps going and going and going. So that's why you have to take that big, broad-based approach. And like Jenny was saying, all systems of the body, we've got this specialist and this specialist and this specialist, and they're all specialists, and none of them work together. But all systems of the body work together. So if you have if you have inflammation in one part of your body, say the GI tract, because you have an infection there, so then you get inflammation because now your body is responding to it and trying to heal that. Well, it's going to eventually affect other organs, other systems of your body, because each system works together. There is no, your endocrine system isn't by itself, being by itself, and then your interstitial system over here is working by itself. I mean, that's not the way it works. They all work symbiotically together. So that's why take a holistic approach, like we always say. So chronic inflammation, that was acute inflammation. Hopefully you got that. So I'll just go back to acute really quick. So with the treatments, we see this all the time. People will come in and they'll have maybe eczema or, really terrible acne, or, some kind of skin issue, giving things like Accutane, which is a terrible drug, or they're giving steroids to alleviate that inflammatory response, like with eczema or psoriasis, something like that. But again, they're really toxic to you. So there's that toxic root adding to inflammation, but all they're doing is, in the short term, bringing down that inflammatory response. So maybe you're not seeing that red swollen rash on your face or whatever it is.
Symptoms are always a signal of something else going on. Unless you have an acute injury that itself, if you break your arm, that is the symptom that happened. But things like skin disease or skin issues, chronic disease, these are signals. The joint pain itself is not the disease, it's what's causing it. The eczema itself is not the problem, it's whatever infection or autoimmune response you're having that's causing it.
Right. And those signals, the pain, the joint pain, or the inflamed face, or whatever it is, those, I always like to think of symptoms as a conversation your body is trying to have with you. So if you didn't have any symptoms, yes, you would feel lovely and you'd look much lovelier and you wouldn't have any weird things happening. But whatever was happening in your body, you wouldn't even know. So if you change your perspective, we're always talking about perspective. If you change your perspective on symptoms and embrace them as a conversation your body is having with you, saying, hey, I am overburdened, I am starting to break down, this is what I'm experiencing, and now you're experiencing, can you check out the problem? Basically it's a conversation with you, just a signal to say, hey, over here, that kind of thing. So definitely embrace your symptoms and really don't own them. That's different. I mean, embrace them in a way that you say yes, and then really, connect with your body and see, really get in tune with your body and see what is happening, and look further into that, if that makes sense. If you own your symptoms, that's totally different. I think we talked about
that's like, they're just part of you. They're never going away. They're like your eyeball, it's just part of me. Oh, well, no.
Right. No. Owning your symptoms is like being the victim mortality. Not mortality.
Sometimes.
But you're the victim, oh, poor me, I'm having this pain, I'm having these things, and you will never get better if you have that. But embracing your symptoms is checking in with your body and saying, okay, I have this pain over here. Let's see why, like, what is going on? Why do I have this inflammation? Let's get to the root of that and fix that. And then that is empowering. Right. So it's the difference between being the victim and being empowered, if that makes sense. But with chronic inflammation, I wrote down, when your body becomes overburdened by your diet, environment, lifestyle, it always comes back to that. And you can't shut off the response. So with the acute, your immune system goes in, you have that inflammation, but then your body, as soon as the healing starts, then your body can shut off that reaction. So chronic is when it doesn't shut off. It just keeps going. And then, like we said, it results in constant inflammation that then can become systemic, which is really bad. But an example of that is, and we see this all the time in our practice, is, if you think about inflammation as like a flywheel, like if you take a wheel and you go boom, and it's and think how long it takes to settle down. So if your body is reacting to something, so let's just say gluten or wheat or glyphosate, because we just did that podcast a while ago. Right. It's reacting to that constantly. So if you figure out that it is reacting to that and you take that completely out of your diet, it takes months and months for that flywheel to finally calm down. So you may have taken out, and that's just one thing. Remember, it is never one thing. Never. But if you take that wheat, gluten, glyphosate, whatever it is, out of your diet, and it's not coming in, the inflammation is still there, and it will take, it can take 6 months. You can eat, if you're reacting in an autoimmune reactory way to say gluten, this much of your thumbnail can set you off for 6 months.
Right.
Inflammation. So keep that in mind.
And when your body is freaking out like that, it's also way more sensitive to other things. So then you might be getting reactions to more minor things that you would normally have reactions to. And imagine it's kind of like that drop in a pool, like it has ripples. All of those have to kind of come in until the whole thing's flat.
Good one too. Yeah. But you do, and if your body's continually reacting, you start reacting to more and more things, like Jenny said. So, and we've mentioned this before, but it's always good to reiterate because it's a lot. But say the wheat protein is XYZ PDQ, right? And then your body's reacting. It's always on the lookout. It's constantly, and then it sees something like chocolate that is 80% that same protein. Well, now it's reacting to that. And then there's a part of your body that is, 85% that same protein. Well, now it's reacting to that, say your thyroid. And so it's just reacting and it's attacking everything. And then it's just overburdened and starts reacting to more and more things, unless you can really get to the root cause, that holistic approach, like we're talking about, where you take everything out and then that flywheel is able to actually settle down. That's the only way. But I had written down, so the causes, so okay, if you think about this, chronic inflammation causes metabolic dysfunction in your body, which then in turn causes symptoms. Okay. So the cause of chronic inflammation, we talked about it, it's your diet, it's your lifestyle, it's your environment, it's every single thing that is in your life that you are doing, that you are taking into your body. It can be trauma, it can be stress, it can be your thoughts, it can be your diet, it can be what you're drinking. It can be everything in your home environment, everything we always talk about. Also what is being done around us that we have no control over. This all causes this inflammation in your body, and then the chronic inflammation causes that metabolic dysfunction. But I just wrote down some examples. So EMFs, big one for inflammation. Glyphosate, our last podcast, if you didn't that, go back and listen to it, because it's all about glyphosate, but it definitely is causing inflammation in your body. Synbio, we did a podcast on that, causing inflammation. Stress, I already said that. Toxins, like all toxins and products across the board. Inflammatory foods, we kind of touched on that. And then inflammatory foods, but then you could be eating a diet that is not even inflammatory at all, but at this point your body's reacting to all those foods. I mean, they could be
like there are foods that are inflammatory across the board, and then there are foods that your body finds inflammatory.
Right, because it's reacting in an autoimmune reaction way. So there is that as well. And then your mindset is huge. I wrote down autoimmune reactions. I guess I already talked about that. All the 8,000 plus chemicals. Just lifestyle stresses, drinking, smoking, vaping, all those kind of things. Antibiotic use, really any pharmaceutical use at all. There's just so much physical trauma, emotional trauma, all of that's coming into your life. Again, diet, lifestyle, environment, and causing this inflammation storm. And that's what happens. And that's why, again, you have to address all of it and the root cause in order to stop it. These 190 answers that were given that were well-meaning are not going to stop that huge tsunami that's going on in your body.
And like Kendra said, you have to give it time too. So a lot of people expect a very quick change, and I think that's just because people are so used to medication that pretty quickly kicks in. But when you're making these lifestyle changes, remember that flywheel effect. It takes time. You will see change up front, but it will be minor change, and then you'll see that change grow. Some people get really frustrated with that. They're like, well, it may have helped a little bit, but not enough to keep up with the work. So just remember, it's not a magic bullet. It doesn't go pow. You're uninflamed. You have to give your body a chance to settle, to realize you're going to keep up with this so that it can change how it's functioning.
Right. And if you don't continue with it, symptoms will come back. And I just, while you said that, I popped into my mind two, in particular, MS patients that we worked with. And I think we use them for examples a lot, but they're just so opposite end of the spectrum, even though they both had diagnosis of MS. So the one, all she did was eliminate that. We have a list of inflammatory foods. That was really all she had done in the mindset work, and all her MS symptoms went away. And she had been diagnosed for 7 years, and she was really bad. I saw her. We've talked about her a lot. I think we even did a podcast with her.
Yeah, it was short. She was not super talkative.
No, but there's a testimonial podcast with her, but they all went away in that very short time. So something that we hit on was what was causing her inflammation, and we were able to bring it down in a very short amount of time. And that was probably a couple months. I mean, it was a short amount of time. And then we had another MS patient that had been like 20 years at least with the diagnosis. She was in a wheelchair. I think we talked about her not that long ago. She was almost understand what she said. She almost was immobile. She was having to quit her job finally. Like, she was really, really bad. And it took 6 months doing the same thing, 6 months. And she was seeing significant changes at that point, but her changes were like, you could call her on the phone and understand what she was saying. And that was huge for her. But she still had so much more to go,
Yeah, like comparatively, she still had a lot of symptoms, even though for where she was at, she was, amazed at the improvement.
Right. But that was 6 months in. And imagine where she was, 3 years from there, from that time, what could happen. And then the other person, MS diagnosis, her symptoms all went away within 2 months. So that time frame on how long your particular flywheel of inflammation is going to go on, that's the one unknown. We don't know. You don't know. Nobody knows. But as long as you do everything the right way.
And they were both very good at sticking to our program, doing the things. They didn't like pick and choose. And as soon as they started feeling better, they didn't quit. So they, their action was very similar.
Right. Yeah. So I think that's why we always use them for examples. They have the diagnosis, their actions, their attitude towards it were very similar. But the time and the way their symptoms went away was different. Yes. If that makes sense. And then so then and I also wanted to just say real quick that, once all of that chronic inflammation causes this metabolic dysfunction, which causes the symptoms, but the metabolic dysfunction also causes inflammation. So it's just adding to that whole reaction you're having. So keep that in mind. So you have this chronic inflammation. Now you have the metabolic dysfunction. When we talk about metabolic dysfunction all the time, that's when all of a sudden your body has things like leaky gut. It's got infections, and infections, that's what we talked about, dysbiosis. So that can be bacterial infections, so bacterial overgrowth, parasites. I keep hearing about people saying, oh, do a parasite cleanse and everything will be better. Right. Why do you have parasites? You got to go deep on that. Things like autoimmune food allergies is a big one, and we kind of touched on that. And that reaction causes inflammation, which causes all this other
right.
And it's not only autoimmune food reactions.
Right.
You start reacting to other things in your environment. So what happens is your gut becomes leaky, so the cells in your gut pull apart. Now food particles and anything that comes into your body is now leaking out into your blood where it shouldn't be. And that's when your body starts reacting to all of these things. So depending on how long this dysfunction goes on, that inflammation keeps ramping up. Nutritional deficiencies, blood sugar irregularities, adrenal fatigue, acidic pH, those are the roots we have on our tree back here. But they just all add to this crazy cyclone going on in your body. And really, those are the root cause of all symptoms, all chronic disease.
Right.
In a nutshell, right?
Yeah, you are not having any kind of chronic disease with zero inflammation. There is inflammation going on. It's there. It's just whether or not you're noticing it or realizing that that's what's causing it. Most people think inflammation like you have to be like puffy and red and hot, but it can, internal inflammation. Imagine if that swelling is in your joints, or that, that's going to cause discomfort, or anywhere else in your body that, heat, blood flow, all of those things are going to change, which isn't always pain, but it is discomfort.
Right. Or some kind of a reaction.
Yeah.
Oh, look, I have symptoms right here in front of me.
Imagine.
The reaction. So I have written down, symptoms are the body's way of expressing itself that is breaking down, burdened. And it's conversation with yourself, right? We already talked about that. So remember that when you have symptoms. And we've talked about this before too, but a lot of times you have symptoms that you don't even recognize as a symptom because you've had them for so long and you think it's just a part of you. So remember to kind of be on the lookout all the time. And just an example of physical symptoms you can look for. Jenny mentioned inflammation. So if you look at your tongue, we were just talking about tongues with one of our certified PHP did a really good video on tongues and what it can tell you the other day. But, you know, if your tongue is swollen and you see teeth indentations on the side of your tongue, that is an indication that you have an autoimmune food allergy.
Right.
So you can look
people you don't realize that that's what it is. So if your tongue is like wavy on the sides,
right.
Maybe it has always looked like that. Maybe you have never stuck your tongue out and inspected it. But it should be smooth around the edges. So if it's wavy, that means it's pressed up against your teeth and it's causing those indentations. Same with people who are constantly like biting the inside of their cheek. That's not like some strange, your face is just not shaped right. It's swelling.
Right. And that your mouth is the beginning of your digestive tract. So yes. If you have swelling in your mouth, you have it all the way through. So you probably have GI issues going on as well. But that's one physical symptom you can look for, as well as the GI symptoms you're experiencing. But you can also look for that, and you know now that your entire system all the way through is inflamed.
Yeah.
Anyway, but symptoms of inflammation could be, these are common symptoms we see all the time that we work with, and that we've also seen completely turn around if you do the right thing. So lots of different skin issues. So just examples are acne, rosacea. A lot of people have rosacea, dry skin, eczema, psoriasis, dandruff, cracking of skin. People have like between their toes, behind their ears, there's cracks, just random rashes. There's just all kinds of things that are skin issues. GI issues that we see all the time: diarrhea, constipation, bloating, mucus.
Basically like a Pepto-Bismol commercial. All those things they say.
Exactly. Blood in your stool, even, immediately have to go to the bathroom, all of those type of things. Low energy, lack of motivation. That's a big one. Emotional issues. There's so many that people are experiencing: anxiety, depression, anger, quick to anger, irritability.
And those are so important to understand, that they can be tied to these internal metabolic inflammation issues. And it's not just like, oh my gosh, you're such a grumpy, awful person. Like it has like a physical reason. It is a symptom, your body trying to talk to you.
Right. Or there's the suicide rate is up so high, and people are depressed and this kind of thing. And the majority of it is coming from metabolic dysfunction, and it's really sad. And then what they do is they give you a medication to, usually everyone we work with, it makes them feel terrible.
Right.
It might help a little bit with the anxiety or whatever they're experiencing, but it makes them feel terrible. It adds to that toxic root. It didn't fix anything to do with the metabolic dysfunction. And so you can see how that just gets worse and worse and worse. But we've seen it a million times just turn around when they're able to get that inflammation down.
Yeah.
Hormonal issues is a big one people are experiencing, PMS, infertility, menopause symptoms. What else?
PCOS.
Yes. Thyroid issue. I mean, there's so many that have to do with your hormones. Even people feeling like they're maybe having identity issues, maybe people feel like they're bisexual or something, and they may be. I'm not saying they're not, but a lot of times these issues are because of a complete hormonal imbalance in your body.
Right. Or, especially when you're like just confused, like feeling confused.
The anxiety, the emotional issues on top of the hormonal issues.
Yeah.
Imagine how you would feel. Also, we see a lot of women that have facial hair, like beards, even full-on beards, things like that. And they're all this hormonal imbalance that is caused by the inflammation in your body. brain, there's so many brain issues like brain fog, forgetfulness. We've seen some severe cases in young people, like this one person. I always use her as an example too, but it was so shocking to me. She was maybe 26 or something, and she had come from Champaign, and she had to have help getting home because she had no idea how to get home to Champaign.
Right. And it was like it's hard to explain. It's not like she couldn't get home. It was like she knew in the middle of getting home, she was going to forget where she was going.
Right. Yeah, we've worked with people that were like in town a few blocks from Target, and they forgot that they were going to Target and where Target was. There's so many of these issues, and it can be concentration issues. It can be I have this thought, but I can't quite pull my thought out and express it into words. Or we've had people come in that their brain was moving so slow that their vocal, what they were expressing vocally was so slow. I mean, so painfully slow. It was like their brain was on slow motion. And then we've had other people that just and cannot.
Like they feel like they have to get it all out or else they're going to forget.
Right. And they like literally cannot turn it off. And it's the same thing. But again, inflammation is causing all of that.
And those add to anxiety themselves, because now you're constantly worried about functioning. So now you're anxious about the issues that are causing those issues, which makes sense. And then it can cause the people around you to be irritated, frustrated, with you. So it has like all of these repercussions that just add in, kind of like that flywheel, and just make all of these things worse.
And again, it's with chronic issues, maybe you can't, like in my own case, my brain fog was so bad. Remember? Jenny knows. I mean, I could not get my thoughts out into words. I wasn't forgetful, but I think that was one of my biggest things. And my cellular energy was low, and my concentration was, motivation low, everything. And so this is just an example, but people around you with any chronic health condition, whatever it is, chronic health symptom, do not understand what's going on with you. And then they get irritated with you, like Jenny just said, because they don't understand, like, what is the deal? Come on, let's go. Or like the person that couldn't find her way to Target, who's going to believe that? She was 40 years old, a young woman, if you just looked at her, beautiful, looked perfectly healthy. Who is going to believe that she literally couldn't?
You get labels like, oh, you're just dumb, you're just lazy, you're just angry, like, and then you start to believe those, you start to own those labels.
Right. So, keep that in mind with the chronic conditions. And then the only thing I just had another example written down was neurological issues. So there's a lot of things like people are experiencing restless leg syndrome or vertigo. We see a lot of people that just are completely just dizzy all the time. Shaking, twitching, paralysis, like one side of your face paralysis. And with the whole COVID situation that we also maybe can't talk about, that's something that people that had the shot are experiencing as a side effect. A lot of these that we just went over, but a lot of these neurological issues.
A lot of them. And then it's getting labels like now it's just metabolic syndrome. Like we talked about, metabolic dysfunction causes all of these symptoms. And then like it's essentially chronic fatigue syndrome, which happened, before, but now it's being attributed to that. And people are being told that there's nothing that they can do. Like they're just going to live with this. It's just how it is. And that's not true. You look at these roots, you take away the interference, you resolve that internal storm, and then you get back to normal.
Right. And we've also seen this all the time. We've worked with lots of people that have had the shots, and it can be turned around if you bring that inflammation down. But that's the problem. Even with that, your body is now reacting. You're having an autoimmune reaction that makes the inflammation go up. So just keep that in mind. And I just wrote down that, remember that okay, so you've got all these symptoms, right? You're going to the doctor, you're trying to figure it out. Now they're diagnosing you with cancer, autoimmune conditions, who knows how many autoimmune
arthritis.
Yeah, arthritis, rheumatoid arthritis, lupus, MS, all the things. But a diagnosis is simply when they can take a group of symptoms, like you have enough of the symptoms that they can group into something that now they can label,
right,
and give you a diagnosis. Because if they can give you a diagnosis, then they have a remedy for that, such as a medication or a surgery, something like that. So just keep that in mind. So if you have a diagnosed condition, I have thyroid, Hashimoto's, things like that, you hear people say, that's a diagnosis, but it doesn't mean that you can't turn it around by bringing this inflammation down,
right?
The root cause. And I've got all these notes. So I've got down the answer, and I think we've already said this like 3 times, but remember, the answer to all of this is to take that holistic approach, like we said. 2 things: fix the internal metabolic dysfunction, which you now know what that is. And that takes a lot, and that's why working with someone will get you there a lot faster. And if you think about, so your metabolic dysfunction, now you have leaky gut, you have dysbiosis, you have these different things going on. Again, a product or a pill or a supplement or a magic bullet is not going to fix that.
No.
Gut either. I mean, you have to do all the things that we just talked about. So fixing the internal metabolic dysfunction and addressing what caused that dysfunction in the first place. Those are the 2 things, and it sounds simple, but it's actually not.
Right, like it's easy for us to say, just do that.
Right.
But we understand that takes a lot of work. It takes a lot of knowledge. Like if you don't have someone who's already been there and done it and knows how to get there, it's going to take a lot of work to research all these roots, all the things that are coming in, everything that's causing interference, everything that's causing inflammation. And that can be really frustrating. You can kind of get lost in that research mode and get away from actually making changes.
And get frustrated. And
yeah, for sure.
Because again, people don't understand what's going on with you, so a lot of people get to that point. But yeah, but you have to do those 2 things. And if you can do those 2 things, which are big, that will bring down the inflammation that you are experiencing, and whatever symptoms that inflammation's causing will then go away.
Right.
It's big. And then I just had written down, when a chronic inflammation response is turned off, that's when your symptoms go away. And remember, we talked about chronic inflammation is when that response cannot be turned off. So you have to get to the point where you can turn off the whole response in a holistic way, not with a magic bullet.
No.
And that's
so that you turn off the response, not the system. Like that's what the pharmaceuticals do. They turn off the whole system. You want that response for what it was built for. If you just turn it off, it's never going to have a correct response. You want to turn off the incorrect response so that when you need it, it can come and do its job.
And that's why those pharmaceuticals work. That's why they know it works, because it's essentially doing the same thing, but using a artificial response.
Yeah.
So yeah, so if you can take all of this information we gave you and put it into action, you can bring that inflammation down, your symptoms will go away. If you feel like you can't do it on your own, you want to get to where you want to be much faster, this is exactly what we do. We resolve symptoms, restore your health, and we do that by addressing root cause.
Yeah. And inflammation's
what we do in a nutshell.
Yeah. It's a funny one. It's not like we don't have a lot of people that come to us and say, I have inflammation. What do I do? Like, that's not a common, like, check off or write in symptom. But like we keep saying, it is that tree trunk that goes from root to symptom. It's there. It's helping all those things along. So even if you are listening to this and you're like, I don't know if I have inflammation, if you have any chronic issues, health concerns that you can't quite figure out, inflammation is there. And that is, something we do resolve, but it's not the only thing that we help with. We help with all those symptoms up in those trees.
But if you have a symptom of any
inflammation,
there's not a cut or a break or something like that, you have inflammation.
Yes.
In your body. I mean, a cut or a break, you also have inflammation, but
right. That's different.
You have inflammation. So this is a really deep dive on inflammation. Hopefully it helped. And that is it.
Yeah, we had a couple people watching, but no questions popped through. So hopefully that means we did a really good job explaining.
They're probably like, what?
All right, either that or we just confused everyone. But hopefully this was helpful and helps people kind of connect their issues with the way to resolve them. And if you feel like someone has these issues going on, share this with them, and always subscribe and like. That helps. And any questions or comments, if you're in the Facebook group, we will always follow up with you.
Thanks for watching.
Yes.
And if you feel like you want the fastest path to resolving symptoms, always reach out.
Yes.
So have a good day.
Yeah.